Hello, good evening. I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. You probably know that yesterday, 8 March, was celebrated as International Women's Day. Often, women have to fight two battles together. One, the pressure from the family, and another, pressure in their workplace. Therefore, sometimes they are in dilemma what to choose first, the career or motherhood. And it's an eternal dilemma, and this dilemma is increasing day by day in the era when more and more women are getting empowered, because nowadays women are no longer considered any backward, or they are no longer less than a man. So they are working equally, and sometimes they are working in more efficient way than their male counterparts. Still, they have to hear when you will get married, when you will take baby, etc., etc. Now, remember, it's completely your choice whether you'll get married or not, whether you want to have baby or not. Nobody can force you. Your friend is getting married, your cousin is having baby. That does not mean that you would like to. Does not always mean that you you should have uh, baby right now, because it's not a competition. You are not in competition with any other, you are rather in competition with yourself, because some people may not find very compatible partner at some point of time, so therefore they have to wait. Some people, on the other hand, may have compatible partner, but because their career goal is more important, because see, everything has its time. Childbearing is important, but at the same time, you cannot compromise your career. Maybe you want to study more, maybe you want to complete your higher education, or maybe you want to be self-sufficient before you want to become parent. Because becoming mother or becoming parent does not only mean giving birth to a child. It's important how you are raising the child, because it makes the difference. If you are not self-sufficient, if you are not in a very well established, if you plan for a baby, then you will be in a mess, because nobody will take care of your baby. It's only your responsibility, you and your partner's responsibility. Maybe today your parents are saying, your friends are saying, your peers are saying, your neighbors are saying, when you have baby, why you are not taking your baby. But once you have baby, it will become totally your responsibility. Therefore, it's important to ask yourself whether I am ready to have baby right now. If you are ready, you can plan for a baby. If you are not ready, I'll suggest you should defer and you should plan when you are totally ready for baby. Because to raise a child, financial independence is important. At the same time, you should at some stable point of your career, and you should have supportive partner. Without this, if you have baby, then you may not be able to raise the baby in proper way. But why people are so much eager to pressurize the woman? Why you are becoming late? Your friends are becoming parents, your cousins are becoming parents, your neighbors are becoming parents. So why you are doing so late? Why they are concerned? Because in human body there is a biological clock. In women in particular, what happens after a certain age, fertility declines and the risk of pregnancy complication increases. Now, why this happens? Because see, in men, you have to remember, eggs are not produced in the ovaries. New eggs are never produced in the ovaries after birth. That is, a woman is born with some finite number of eggs in the ovaries. That is, when a woman was in her mother's womb, at that point of time, only eggs were produced. And after birth, in every month, number of eggs are getting destroyed. Therefore, as the woman uh, becomes mature, as her age increases, the number of eggs decline. And this decline is particularly sharp when you are 35 years. That is, after 35 years, your egg counts start decreasing, and after 40, it sharply declines.
However, there are some women for whom even at 25, 30 years of age, egg counts may decline. And it is usually reflected by a hormone called AMH, anti-Mullerian hormone. However, this is not always easy to consider motherhood just because your biological clock is ticking and your egg count is declining. So what you can do? Remember, nowadays there are many women who are becoming mother at the age of 35, 40. It's not so uncommon, and it's particularly increasing. Nowadays, we are getting more and more women who are coming to us for fertility treatment after 35 and 40 years, and most of them are becoming a mother either naturally or by some assisted reproductive techniques. So treatment is always there. And of course, if your age is more than 35 or 40, the chance of pregnancy complications increase, like risk of miscarriage, risk of some abnormalities in the baby, risk of some damage to the baby, or risk of fetal death, risk of premature delivery, and for yourself, the risk of high blood pressure in pregnancy, we call this preeclampsia, the risk of diabetes in pregnancy, the risk of bleeding in pregnancy, and life risk for both mother and baby all increases. But that does not mean that every woman at 35, more than 35 years of age, will experience such complications. And even see, even if you are at 25 years of age, even at that age, pregnancy carries some risk. Although as the age increases, the risk increases, but that does not mean that always women at 35 years will have highly high risk pregnancy. Why so? For example, when you are crossing a small road, the risk of accident is there, but risk of accident is extremely small. On the other hand, when you are crossing the highway, the risk of accident is significantly higher. But that does not mean that everybody who is attempting to cross a highway will meet accident, and everybody who is trying to cross a small road will not have accident. Risk is always there, but it's our duty to observe you so that we can minimize the risk. So how a woman can balance between career and pregnancy? Why? How it is possible? There are some women for whom we advise try not to delay pregnancy, particularly women whose age are more than 35 years, who have endometriosis, whose AMH is already low, who had previous surgery in the ovaries, like ovarian cystectomy or ovarian removal of ovary, or some operation in the ovary because of tumor or cyst or so. Or women who received previous chemotherapy for cancer treatment, or women whose mother or sister had history of premature menopause. That is, if your mother or sister had menopause, that is total completion, total cessation of menstruation before the age of 40 years, then you are at risk of having premature menopause. But it can happen that we are advising you don't delay pregnancy, but you are not ready to have pregnancy right now. What you can do? The answer is egg freezing or embryo freezing. First of all, you have to understand what's the difference between egg and embryo. Egg means egg is produced in the ovary. We can collect the eggs from the ovaries and freeze it. Embryo means we are collecting the eggs from the ovaries. Then in the laboratory, fertilization, that is meeting of eggs and sperms are done. That is meeting of your eggs with the sperms of your husband, and the embryos will be produced, and these embryos will be frozen. Therefore, if you have stable partner or if you are married, you should consider embryo freezing, because the success rate of embryo freezing is slightly higher than success rate of egg freezing. Although nowadays the success rate of egg freezing are increasing gradually. But if you are not having a stable partner, or if you are not married till now, you can consider egg freezing. This is called social egg freezing. How it is done? To be honest, is just like the process of IVF. We'll give you some injections called gonadotropin injections. Remember, these injections are not painful, although they can sometimes cause some discomfort. These injections are taken intramuscularly, that is in the muscle, or subcutaneously, that is under the skin. Usually need to take injection for 10 to 15 days, after which we'll collect the eggs. How eggs are collected? Remember, this process is not painful because it is done under anesthesia. Total under short anesthesia, it will take hardly 15 to 20 minutes of time. Under anesthesia, we will insert a needle under ultrasound guidance through vagina in the ovaries, and then from the ovaries we will collect the eggs. And these eggs will be frozen. And if you have partner, these eggs will be fertilized with sperms. This is called IVF or in vitro fertilization, and then the embryos will be frozen. Now, how these eggs or embryos will be used? Whenever, suppose today you are for 32 years and you are married, your embryos will be frozen now. Suppose you are planning to take pregnancy at 36 years, then you can freeze your embryos now, and at 36 years you can come and will transfer the embryos, because embryos will not be damaged by freezing process. Embryos will be checked only when the embryos will be transferred. That is, suppose today we are freezing the embryos, we won't check embryos repeatedly because it can cause damage. We'll check the embryos only when you will be ready for pregnancy. And embryos can be stored for 5 to 10 years depending on the law of the land. Whenever you are ready, we can transfer the embryo. On the other hand, if you are not having partner or if you are unmarried, we can freeze the eggs. Suppose today you are 30 years, you are planning to get married at 35 years, and you are planning to have baby at 38 years. So at 30 years, we can collect the eggs and we can freeze them. When you will be 38, probably by that time you can have stable partner. At that point of time, we'll fertilize the eggs with your partner's sperms, and the resulting embryos will be transferred inside your womb, inside the uterus. What's the success rate of this procedure? If it is embryo freezing, remember, first of all, I'm talking about the success rate of freezing. If it is embryo freezing, 99% of embryos will survive when we'll freeze, and after that when we'll warm them. That is, suppose we are freezing 100 embryos. After 5 years, 99 of these embryos will survive, although it depends on the age of the mother, that is at the age at which embryos are frozen, and of course the quality of the embryos. And the quality of the embryos depend on the age of the mother, quality of the eggs, age of the father, and quality of the sperms. What's the success rate of egg freezing? It's nearly 90%. It depends on laboratory. That is, if we are freezing 100 eggs, 90 can survive over the period of 5 or 10 years when we'll warm them. Now, suppose the embryos are produced and embryos are transferred. What's the success rate of pregnancy? The success rate of IVF is overall 50%, 40 to 50%. That is, if we are transferring 100 embryos, out of 100 women, 40 to 50 can conceive in one cycle. If you cannot conceive in one cycle, if you have extra eggs or embryos, those extra eggs or embryos will be transferred in subsequent cycles. Sometimes women ask, doctor, when you are taking the eggs from the ovaries, don't you think that you are basically taking the eggs from the ovaries, that is, you are further diminishing my egg counts? The answer is no, because as I mentioned, the number of eggs are declining as the woman's age increases. Therefore, for every month, only one egg is getting matured and the rest 100 eggs are getting destroyed naturally. When we are doing embryo freezing, when we are doing egg freezing, or when we are doing IVF, we are giving hormones so that we can rescue some of the eggs from damage. That is, these eggs would otherwise undergo destruction. These eggs would otherwise not be available to have pregnancy. But we are stimulating the eggs by giving hormones from outside, and these eggs will be available to give pregnancy. Therefore, because of IVF, the number of egg counts in the ovaries are not decreasing. Because of egg freezing, the number of egg counts are not decreasing. Because of embryo freezing, the number of egg counts are not decreasing. Therefore, it's important to know, if you have not yet decided to have baby, if you have not yet decided for marriage, you can consider egg freezing or embryo freezing. In this way, you can balance between your career, your education, your job opportunities, and your wish to become mother. Thank you very much for watching this video. If you like this video, please subscribe our channel, YouTube channel, and Facebook page. Thank you very much.